It's a wonderful feeling to have a partner.
Discover NVNA and Hospice.
In healthcare today, with managed Medicare and so forth, people have so little choice, so we try to emphasize that this is a choice you really have. People who are Medicare beneficiaries have a choice in who comes into their home. That is an absolute regulation. They need to know that they have the right to ask for us.
Well, I was wondering about whether it be in another hospital or it be home. I could have home care, which I understand I could have. Friends of mine and other people I know were quite familiar with the Norwell visiting nurse. And I called them up and they seemed very friendly over the phone. And I wanted to get in on that program.
I'm in the process of developing a role for home health nurses here that's called the Nurse Navigator. The Nurse Navigator is somebody who already has a role in the hospital helping individuals navigate this very complex, disjointed healthcare system that we seem to be in right now. The patient may be going to a skilled nursing facility for rehab. So it would be nice for that nurse navigator to follow that patient through the rehab setting and be that person who is the connector of appointments and making sure that all the things that patients need to do in a very confusing and complex time for them, that gets done. So when somebody is being discharged from an acute care facility, ideally, you would like to meet with that person before they leave so they understand where they're going next, that their medications are reconciled, that they understand the types of services they need or we think they need, and jointly we can decide on a care plan once they get home, and that they already have a number, a telephone number or a touchstone where they can contact you once they get home before we get out there to have a discussion with them, or so that they're not feeling alone going right from the hospital to home. The lowest cost service in American healthcare is home care. Well, we've been around for 95 years and have been able to demonstrate outcomes that are very, very high, positive for patients.
The doctor wanted me to go to a rehab place for a short time, and fortunately, because of the visiting nurse program here, I didn't have to stay very long. Just having someone come in twice a week and really tell you how well you're doing or how well you're not doing, it was just sort of magical. She came to see me, came routinely, and if there were any problems at all, she was right on the phone taking care of them. It was absolutely amazing. You just couldn't have had better care than that.
When I speak to groups about what is, as opposed to what was, I always ask the question, who do you think is responsible for your health care? And universally people said, the doctor. No, that isn't the way it is today because we're so fractured in the system itself. Information flow is so critical, things can be lost. People need to get the message that they or a caregiver are really the responsible party. We are the community representatives for healthcare, not only preventative, but education. So people don't think twice about calling us and asking us advice or saying, I have a sick neighbor, can you help us out? We're the right size to be able to provide the right care at the right time in the right place, and that's home.